Assalamu alaikum warahmatullahi wabarakatuh. I'm gonna talk today about the development of the neural tube and the spinal cord. I'm Dr. Dalia Saleh, professor and the head of anatomy department at Mansour University. Let me remind you first by the events that take place at the second week of pregnancy. If we look at this diagram, this is the endometrium of the uterus, and this is the gestational sac here. We have the embryonic disc, which is formed in the second week by two layers, epiplast and hypoplast. Dorsal to the epiplast, we have the amniotic cavity, and ventral to the hypoplast, we have the yolk sac cavity. If we take a section at the cranial end of the embryonic disc, at the level of the prochordal plate, we can notice the closely adherent epiplast to the hypoplast. This is called the buccopharyngeal area, or the buccopharyngeal membrane, or the procaudal plate. During the third week of pregnancy, an important event takes place, which is called the gastrulation or formation of the trilaminar embryonic disc. So if we cut open the amniotic cavity and we are now looking at the embryonic disc from above, we have at the center, nearly at the center, we have a collection of cells called the primitive node. And in the caudal half of the embryo at the midline, we have the primitive streak. And these areas in the epiplast are areas of high activity of the cells, and the cells here are proliferating. So from the sides of the primitive node and the primitive streak, the three germ layers will form, the cells of the three germ layers will form, and this new layer is called the intra-embryonic mesoderm, which insinuates itself between the ectoderm and endoderm and form the third layer or the three layers of the embryonic disc. Also from the primitive node, a solid cord of cells proliferate and migrate towards the prochordal plate. This is called the notochord. The notochord lies here underneath the ectoderm. For the neural tube formation, or the process which is called neurulation, if we look at this diagram, this is the notochord, and overlying it lies the ectoderm. The neural tube arises from the ectoderm overlying the notochord here, and eventually will give rise to the brain and the spinal cord. And you can notice the presence of two flexures, the cervical flexure between the brain or the future brain and the spinal cord, and another flexure appears in the brain here. It's called the cephalic flexure. Again, if you look at this diagram, you are looking to the ectoderm from above. This is the cranial end of the embryo, because this is the wide part, and this is the caudal end of the embryo, the narrow part. Here we have the prochordal plate at the cranial end of the embryo, and we have the cloacal membrane here at the caudal end of the embryo. In the middle we have the primitive node, and in the midline, in the caudal half of the embryo, we have the primitive streak. From the primitive node, a solid cord of cells grow towards the prochordal plate. This is called the notochord. So what happens that the notochord induces the ectoderm overlying it, and then the notochord is considered to be the inducer of the formation of the neural tube. Then the ectoderm will thicken to form what's called the neural plate. With further growth of the notochord, when it grows more and more and more, also the overlying ectoderm grow and transform into a slipper-like plate, which is called the neural plate. If we take a cross section in the previous picture, we're gonna see here the notochord, and this is the overlying ectoderm, but just above it, just above the notochord, the ectoderm become thick and form the neural plate. With further growth, the neural plate folds because the rate of proliferation of the cells in the neural plate is different from the rest of the ectoderm, so it is forced to bend upon itself or to form folds here at the sides, the dark blue area. And now the neural plate is transformed into a neural groove. With further growth, the neural folds approach each other because the neural groove deepens more and more, till the two neural folds will fuse together and the neural tube now is formed. Then the neural tube will separate from the overlying ectoderm. In this electron microscopic pictures, you can see the shape of the neural groove here, and these yellow dots represent the area of the neural folds here. So this is the neural groove. Okay, you can see it here, and this is the neural folds. It will be like this. The neural groove here, right? And these are the neural folds which now approximate to each other and about to close. Okay, so what about the neural tube closure? The closure of the neural tube begins in the future neck region of the embryo, approximately at the fourth somite stage. This is the place of the neural tube, and actually this is the neural groove stage, and these are the neural folds. These edges are the neural folds, and you can see 4 somites on each side here. So the closure begins at the fourth somite stage in the future neck region. Then the closure proceeds both cranially and caudally. So the closure begins here in the neck region, like we said, and proceeds both cranially and caudally. And you notice that the somites increase in number. This is with the progress of the age of the embryo. This simple animation represents the way that the neural tube closes. It first closes at the neck region, and then the closure spreads both cranially and caudally. The most cranial end and the most caudal ends of the tube still open, and that's why we call them neuropore. The cranial neuropore or the anterior neuropore here, and this is the posterior neuropore. The anterior pore will close around the day 25 of pregnancy, and the place of the anterior neuropore will form the lamina terminalis, while the posterior pore closes at or around day 27 of pregnancy. After complete closure of the neural tube, the lumen of the tube now will form the ventricles of the brain or the central canal of the spinal cord. For the spinal cord, the cells of the neural tube migrate to form the mantle layer, which will later on give us the gray matter of the spinal cord. And it will differentiate into the following areas. An alar plate or dorsal plate mostly contains sensory neurons, and the 2 basal plates, or the place of the ventral horns actually, and it will be formed mostly of motor neurons, and they will be separated by sulcus limitans. So the sulcus limitans limits the alar plate from the basal plate. Here is the alar plate, here is the basal plate, and this is also the sulcus limitans. The cells of the mantle layer have axons which collect into the marginal layer that will later on give us the white matter. So the cells here in the alar and basal plates have axons. The axons will collect around the mantle layer. We call this layer the marginal layer. Later on will give us the white matter of the spinal cord after myelination of these axons. And this is the final shape of the cross section in the spinal cord. We have the mantle layer or the gray matter, which looks like the letter H, and around it lies the white matter, which contains the myelinated axons of the spinal cord. Here's another diagram. You can see the central canal lined by ependymal cells. We have here the alar plates, and we have here the basal plates, and from these cells axons will arise. For the histogenesis of the spinal cord, let's see first the components of the neural tube, or the cells that present in the neural tube. It's formed by what's called neuroepithelial cells. So these are the neuroepithelial cells surrounded by cells from the mesoderm, and these are the neural crest cells here. So the neuroepithelial cells will give many lines. The first line is called the neuroblasts, which will give us the neurons with its various shapes: apolar neurons, unipolar neurons, pseudo-unipolar neurons, bipolar neurons, and multipolar neurons here. Also will give us another line called glioblasts. This is the mother of the glial cells, and the glioblasts will give us the astrocytes and the oligodendrocytes. And the remaining cells will form the ependymocytes, which will line the central canal and the ventricles of the brain. Then from the mesodermal cells around the spinal cord, we will have the microglial cells. So all of the previous cells are ectodermal in origin, except the microglial cells are mesodermal in origin. Then the neural crest cells, which are formed from the neural fold cells. They first lie between the neural tube and the surface ectoderm. Then they disperse and migrate to new locations in the body and give many derivatives. I will give you some of them, and we will memorize them by the mnemonic games. The G reminds you of the ganglion cells, either dorsal root ganglia, cranial sensory ganglia, autonomic ganglia. A reminds you by the arachnoid and pia mater, the inner two layer covering the brain and spinal cord. M reminds you by the melanocytes, the mesenchyme of the pharyngeal arches. The E reminds you of the enteric ganglia. This is a kind of autonomic ganglia that present in the intestine or GIT. S reminds you by the Schwann cells and the suprarenal medulla cells. And of course, all of these are ectodermal in origin. This is a simple animation. It shows you the neural tube after its closure. The lumen here will form the central canal. This is the surface ectoderm. This is supposed to be the site of the neural fold or neural crest cells, but they now migrate around the spinal cord to form the dorsal root ganglia here. For the myelination of the spinal cord, myelination of the peripheral nervous system differs from that of the central nervous system. So, myelination of the PNS or peripheral nerve cells comes from the Schwann cells, which wrap itself around a single segment of the axon, many layers like this, while myelination of the central nervous system comes from the oligodendroglial cells. We have few processes. Each process will wrap around different area or different axon. So the main difference between the Schwann cells and the oligodendrocytes, the Schwann cells only myelinate single segments of the axon, while oligodendrocytes can myelinate many axons in the same time by these different processes. For the tissues around the spinal cord, you know that the spinal cord lies within the vertebral canal, which is formed by the pedicles and laminae and the spine of the vertebrae, right? And also it is surrounded by 3 layers of meninges, the pia mater, the arachnoid matter, and the dura mater from inner to outer. So if we know how, if we want to learn how these tissues develop, let's look at this diagram. This is the notochord, this is the neural tube, this is the surface ectoderm, and on each side of the spinal cord we have the somites, right? The neural crest cells, first they will form 2 of the layers surrounding the spinal cord, the pia and arachnoid matters, while the mesoderm surrounding the neural tube will give us the dura mater. Then the somites, we will later explain them, but however parts of the somites will form the sclerotome. The sclerotome cells will migrate around the notochord and spinal cord and will form the bodies of the vertebra here around the notochord, and extension comes out of this body to form the pedicle and the lamina, and when they fuse they will form the spinous process or the spine of the vertebra. So again, this is the final shape or final look of the spinal cord and the surrounding tissue around it. So here is the spinal cord surrounded by the pia and the arachnoid matter, which are derived from the neural crest cells, and then a layer of the dura mater, which is surrounded from the surrounding or derived from the surrounding mesoderm. And we have in front of the spinal cord we have the bodies of the vertebrae, comes from the somites also, and from this body's extension or pony projection develop, which is the pedicles, the lamina, and when they fuse together they form the spine of the vertebra. For the spinal cord positioning, because of the differential growth of the spinal cord and the surrounding tissue, we have different position of the spinal cord during further or many stages of development. At the 3rd month of pregnancy, the spinal cord and the surrounding tissue of the vertebral canal, they are of the same length. At birth, the spinal cord terminates at the level of the 3rd lumbar vertebra, because the vertebral column grows faster than the spinal cord. At the adult stage, the spinal cord terminates at L1, or sometimes between the disc between T12 and L1. For the spinal cord anomalies, we have the spina bifida, but actually the spina bifida is deficit in the formation of the vertebral column or the spine of the vertebral column. So for the spina bifida, we have 2 types: spina bifida occulta or hidden, and spina bifida manifesta or manifest or shown up. The spina bifida occulta has 2 types, or presented by 2 types, either by spinal dermal sinus or a tethered cord. While spina bifida manifesta, we have many types of it. We have the meningocele, meningomyelocele, and myelochassis. Spina bifida occulta the pathology here, or the problem here, there is no fusion of the vertebral arch, and the spine is deficit. It's common in the lower back region between L5 or S1. It is asymptomatic, means that the patient is not suffering from neurological deficit, just few complaints, and could be discovered accidentally during a simple procedure like X-ray. It's only represented by a small dimple or abnormal presence of hair tuft overlying it, like this. If we enlarge this area in order to see it, okay, you can see just a small sinus here over the lower back region, this one. For Spina Bifida Manifesta, the first type is called the meningocele. In this diagram, you can see the spine of the vertebrae, and it is deficient here. Inside the vertebral canal, you can see the spinal cord and the coda equina, or the nerves coming out of it. And this red area represents the meninges, or the meningeal sac around the spinal cord. So for meningocele, there is unfused vertebral arches and a protrusion of a fluid-filled sac or cyst made by the meninges. That's why we call it meningocele. The spinal cord and nerves are not found in this sac, and they are in their own place. That's why there is no massive neurological manifestation in this case, only presented by some neurological manifestation. The other type of Spina Bifida Manifesta, we have the meningomyelocele. Here there is a protrusion of a meningeal sac, this one, like before, but part of the spinal nerves or spinal cord, if it's high up, will be protruding in this sac. And because of the protrusion of the spinal nerves into the sac, these nerves won't go to its destination, so there will be paralysis of the lower limbs, incontinence of urine and feces, and also because of the traction on the spinal cord downward, there will be learning disability. Like this one, you can see a massive deficit in the back of this baby here. The other type of Spina Bifida Manifesta, we have the myelochisis, in which the neural groove fails to close. If it's caudal, means that if it is at the region of the spinal cord, we have the myelochisis. And in this case, we have the spinal cord which is completely exposed to the surface, and there will be severe neurological manifestation, in this case incompatible with life. And if it is cranial, we have the anencephaly. The brain will not form, and also the skull cap overlying it will not form. So you can see this is the head of the baby, this is his eyes, the ears here, and over the eyebrows you cannot see any skull cap or the brain, only the brainstem appears. This is the end of my presentation, and thanks for listening.